Welcome all. Good evening. My name is Mehta Ghosh, and I'm the Health Policy Coordinator at CACF, the Coalition for Asian American Children and Families. On behalf of CACF's Project Charge, and along with CACF co-directors Vanessa Lang and Anita Gundana, I welcome you to our interdisciplinary conversation today on Asian American Pacific Islander mental health. May is both Asian American Pacific Islander, or AAPI Heritage Month, and Mental Health Awareness Month. And CACF is so grateful to have United States Congresswoman Grace Meng's office and New York City Council Member Linda Lee's office as co-sponsor of today's event. We are all gathered here today with a shared commitment to improving mental health in the AAPI community. And we know that a critical step is to promote dialogue among individuals working across disciplines to support the mental health needs of our community. Today's panel discussion is a kickoff for CACF Project Charge's long-term collaboration among members of the API community with the goal of improving the mental health system for everyone. CACF's Project Charge, which stands for the Coalition for Health Access to Reach Greater Equity, was created in 2008 in response to a need for more concerted and coordinated efforts to bring the API community together to address health issues impacting our community. Today, it is a collaborative of 17 organizational partners that includes community health centers, research centers, and AAPI social service providers. I'd like to personally acknowledge the steering committee of CACF Charge members that made this event possible. The New York Coalition for Asian American Mental Health, the Korean Community Services of Metropolitan New York, AAPI Community Health Center, and the Chinese American Planning Council. CACF is grateful to be a part of a deeply collaborative effort to identify the gaps in our mental health system and to meet the mental health needs of our diverse AAPI community through holistic, community-centered solutions. Before I introduce today's keynote speaker, moderator, and panelists, I want to take a moment to recognize the truly devastating tragedies that have happened the past 2 weeks. We have seen violence in Buffalo, New York, Dallas, Texas, Laguna Woods, California, and Uvalde, Texas, amongst others, with most being motivated by racism and hatred. These acts of violence are despicable and can take a huge toll on our mental health. So I want to remind everybody here to take as much time and space that you need. Your mental health comes first. It also goes to show the importance of collectively pushing our policymakers to do the right thing and to create and implement humane policies that prioritize everybody's mental well-being. I will pause shortly to give folks some time before we begin our event. So now it is my honor to introduce our keynote speaker, U.S. Congresswoman Grace Meng. Congresswoman Meng is serving her 5th term in the United States House of Representatives. She represents the 6th Congressional District of New York, which encompasses the New York City Borough of Queens, including West, Central, and Northeast Queens. Representative Meng is the first and only Asian American member of Congress from New York State, and the first female Congress member from Queens since former vice presidential nominee Geraldine Ferraro. Representative Meng has fought tirelessly to expand opportunities for communities of color, young people, and women. Born in Elmhurst, Queens, and raised in the Bayside and Flushing sections of the borough, Representative Meng attended New York City schools, graduated from Stuyvesant High School, and received her bachelor's from the University of Michigan and a law degree from the Yeshiva University's Benjamin Cardozo School of Law. Representative Meng, we are so thrilled to have you here with us today.
Thank you so much for having me and for including me in today's event. I am such a fan of so many of the people here on this Zoom. First, I want to thank my colleague, our newish councilwoman, Linda Lee, for spearheading this event. Our city and our communities are lucky to have someone like Linda, and I told her that she was made for this moment as we are witnessing how much our communities are going through, whether it's gun violence or racism. It's really important that we address this issue. So much of mental health organizations and resources have really gone underinvested for such a long time. And I remember being at Linda's KCS opening of their mental health program, which was really one of the first in the city, especially to serve the AAPI community. Really thrilled to be back working with CACF and Project Charge. I've worked with leaders like Vanessa way back in the New York State Legislature when I was the only Asian member, and now we have a whole caucus. It's so beautiful. We have a caucus in the state ledge, we have a caucus in the city council. and really thank CACF for a lot of visionary projects to make sure that there is ongoing dialogue between our parents and our families with government agencies. Government can always do better, but we need to make sure that government is meeting people where they are, and providing language access. And CACF and a lot of the groups on this call today do that every single day. And we have witnessed and are so grateful to all of you for the work that you've done, especially during the pandemic, when we saw that government was not providing all the answers. And it was our community members, our organizations, and leaders like yourselves who consistently pointed out the gaps in government services and helped guide us to do better. So I'm so thankful. The pandemic, I don't have to tell all of you, has negatively affected many people's mental health. According to the Kaiser Family Foundation, about 4 in 10 adults in the US have reported symptoms of anxiety or depressive disorder, up from 1 in 10 adults who reported these symptoms in 2019. For the AAPI community, the burden has only increased out of fear for their safety. The increased need for mental health services has highlighted the issue of access. Many of our constituents in the AAPI community have struggled to find clinicians who speak their language or understand their cultural background. For many, these barriers only exacerbate the stigma surrounding seeking this critical care that already exists in many of our cultures. I remember when I first got elected to the New York State Assembly, I was talking to the city. I said that there needed to be multilingual access to hotlines and resources in different languages, Asian languages. And the city said to me, literally, that nobody needs help because they aren't calling the hotlines. I said, they're not calling your hotlines because you don't have help readily available in their languages. Of course, they're not calling you. They can't communicate with you. And so that's why your work is so important. I've been trying to work on this issue from the federal level. I introduced a bill called the Mental Health Workforce and Language Access Act that would ensure that our community health centers, so many of your organizations, have more resources to hire mental health professionals with the appropriate cultural and linguistic knowledge to care for the AAPI community. We've also seen in our city the need for mental health care, especially in relation to the uptick in the past few years of bias incidents, violence, and murders of Asian Americans. I know, and you all know, how critical it is that people have access to mental health care and other wraparound services. And we gather, as was mentioned earlier, in the midst of a really tough time for our country. And regardless of what party you're in, regardless if you're a parent, regardless of where in the state or country you live, our hearts as Americans are breaking today. We watched this massacre in Buffalo just a few days ago, and now are watching, it's just even hard to watch the clips on TV and social media of the tragedies that have happened in Uvalde, Texas. And even more so, it's important that we're there for each other. It's important that we take the time just to, check in on yourself and people around you. Know that I'm here for you, not just as your local elected official, but as a friend and a colleague, and as someone who is, like all of you, on the receiving end of so much of what our community is going through. So please don't let this just be a one-off conversation. I'm here for you and look forward to however we can work together. I also want to just quickly acknowledge some of my city council colleagues who I think are on the call today, council members, Vicky Palladino, my councilwoman, and my friend, Councilwoman Carlina Rivera, and I bet you I'll leave out someone, so someone will get mad at me, but that's politics. But thank you all for being here.
Thank you so much, Congresswoman Meng, for your words. We are deeply appreciative of you taking the time and energy to join us today. Honored to also be joined today by Dr. Ashwin Vasan, who is the Commissioner of the New York City Department of Health and Mental Hygiene. Dr. Vasan is a primary care physician, epidemiologist, and public health expert with nearly 20 years of experience working to improve physical and mental health, social welfare, and public policy for marginalized populations here in New York City, nationally and globally. Thank you, Dr. Vasan.
Hi, everyone. Thank you to CACF. Thank you to Councilmember Lee. Thank you to Representative Meng, and thank you to everyone here. Hi. Thank you to everyone here for coming together around this really critical conversation. It's my honor to serve as the Commissioner of Health of New York City. My name is Ashwin Vasan. I've been in the role for about 2 months, a little over 2 months. And one of the main reasons I came to this role, I'm a primary care physician, I'm an epidemiologist, and yes, we're working on COVID, and yes, we continue to battle whatever comes our way, monkeypox, Legionella, but I came here to work on mental health. I came here to center mental health in the public health agenda of our city, really for the first time in a long time, and at a moment of really urgent need, a moment of critical importance to the city coming out of the pandemic. The representative mentioned the data, some of the data that shows that people are really hurting at unprecedented scale in this phase of the pandemic as a result of the pandemic. And as I've noted in other forum, we've had an increasing mental health epidemic for years. 20 years we've seen increasing rates of death by suicide and alcoholism and overdose. And so this is not anything new. This is something that has gotten worse. And specifically, it's gotten worse for our API brothers and sisters. It's gotten worse for our API community, especially in the wake of COVID and in the midst of COVID and the rise in anti-Asian hate and discrimination and violence, to the extent that some don't feel comfortable leaving their homes, riding the subway, existing in their community safely. And the cumulative trauma, let alone the direct traumas of violence and witnessed and experienced violence. This is a moment where we need to really have an all hands on deck approach. The city, the state, and the federal government, I think, are cooperating in a way that I don't think we've seen in really a long, long time. And you have a city, a state, and a federal government committed at the same time to addressing the mental health crisis. And as we do so, we have to center communities that are left behind, and the API community is front and center in that challenge. I know this personally. My family has experienced a host of mental health challenges since I was a child, and I've watched my parents and my community members struggle to even have a basic understanding and language around mental health. It's not something they grew up with. It's not something that exists in our culture. These words, depression, anxiety, these aren't words that are used in the community that I come from in South India. And so how do we create in an environment, in a country where 1 out of 3 Americans can't get access to mental health care when they need it? Same is true for New Yorkers. In an environment where at baseline, mental health care is hard to access, where because of systemic and intergenerational defunding, underfunding of mental health systems, we just don't have enough providers, we just don't have enough access to care, we just don't pay enough for care. How do we then take account for the needs of minority populations, vulnerable populations who don't see providers that look like them, that speak their language, and that can relate to them and provide mental health care in the way that meets them where they are? I think the way that we do that is by investing in community organizations that are already trusted and engaging hard to reach communities, vulnerable communities, and API communities. And we've learned a lot about this from COVID. In the early stages of the pandemic, we built massive infrastructure to get testing and then later vaccination up and running for the entire city. But there were still communities being left behind. And we saw a disproportionate impact on Black and Brown and other BIPOC communities. So we took effort to really engage with CBOs over the last year, 85 CBOs through our public health core program, to bring them the resources and then get out of the way. Really government getting out of the way, but helping, providing capacity, providing monies and resources at an unprecedented scale to deliver vaccines, to deliver treatments, to deliver PPE. And we've seen incredible results in those vulnerable communities. The communities hardest hit, we've seen vaccination rates close, we've seen testing rates increase, and now we're seeing treatment rates distributed more equitably than we would have had we not had this infrastructure. I'd like to see these community partnerships be applied to mental health. Now that we're in this transitional stage of the pandemic, I'd like to see us resource organizations, resource community groups that serve the API community and that can really bring services in the way that people need them, close to where they live and in an easy, accessible way. This is the only way we bridge the gap between the better mental health system that we need to build through massive investment and the immediate needs now that communities are facing. I want to thank you all again for convening this important discussion. It's so good to be here today. I'm so glad we're talking about this issue now. After 2 years of just talking only about COVID, I'm really glad to be here today and just thank you so much. Appreciate you very much.
Thank you so much, Commissioner Bassan. I really appreciate your attendance. I'd like to now introduce our moderator and panelists who represent, sorry, one second. Okay, there we go. I'd like to now introduce our moderator and panelists who represent the work our AAPI community is doing at multiple different levels, from the individual level, researcher level, community-based organization level, and policy level. Today's wonderful moderator is June Matsuyoshi. June is the Director of Mental Health Services at AAPI Community Health Center, located near Chinatown, Manhattan. AAPI is a federally qualified health center that serves many populations, including Asian Americans and Pacific Islanders, Latinos, African Americans, and individuals who identify as lesbian, gay, bisexual, or transgender, as well as those living with HIV and AIDS. Her professional interests include learning about the impact of trauma in individuals. She's also interested in the historical evolution of Japanese and Japanese Americans in World War II and its aftermath. She is joined by panelist Sunanda Jalote. Sunanda is a therapist working primarily with queer and trans clients of color. Sunanda spent most of their life in India, where they worked in the field of gender justice and mental health awareness before moving to New York, where their work and goals are informed by personal, professional, and cultural experiences in India. As a mental health professional, Sunanda aims to make mental health care more accessible for those who need it most. They help folks connect with different aspects of their culture and history, work on undoing the devastating impacts of generational trauma, and connect with their learned intergenerational resilience, all to find ways to safely be authentic in our current world. Our next panelist is Dr. Nahid Ahmed, who is a mixed methods researcher with an interdisciplinary background in family science, public health, and medical anthropology. Her research interests include mental health, chronic diseases, and comorbid disorders, specifically looking at how discrimination shapes these adverse outcomes among stigmatized populations. Dr. Ahmed has developed novel scales for measuring experiences with Islamophobia in the United States and has studied in the health implications of Islamophobia on Muslim Americans. She currently works as a research scientist at the NYU Grossman School of Medicine in their Department of Population Health and the Institute for Excellence in Health Equity. Our final panelist is Councilmember Linda Lee, who represents the 23rd Council District in Eastern Queens. She's a current chair of the Committee on Mental Health Disabilities and Addictions. Prior to taking office, Councilmember Lee was the president and CEO of Korean Community Services of Metropolitan New York, or KCS. During her time at KCS, Councilmember Lee spearheaded the creation of the only state licensed Article 31 mental health clinic serving the Korean American community operating in New York. She received her Master of Social Work from Columbia University and her Bachelor of Arts from Barnard College. Councilmember Lee is passionate about improving healthcare and mental health access to New Yorkers and promoting the well-being of seniors in New York City. I will now be handing over the mic to June.
Thank you for that introduction. It is really an honor to be part of this panel this evening, and I'm looking forward to some very interesting discussion. We certainly are in a time of crisis, and the Japanese characters for crisis are composed of two characters, danger and opportunity. So in the face of danger, we face challenges to be creative and opportunities to provide services in a way that's going to be useful and will be really answering the needs of the people we serve. I'd like to give the panelists an opportunity to talk a bit about the services that they and their organizations provide vis-a-vis mental health and related services. Council Member Lee, would you please start and tell us a little bit about the work that you and your staff are doing?
Hi, I'll try to be short because I'm curious. There's a lot of experts in this room right now, and y'all are, doing the work more so than I am on the ground. But and shout out, like we mentioned to Councilwoman Carlina Rivera, as well as Councilwoman Vicky Palladino, who also serves with me on the Mental Health Committee. And I think there was a lot that I saw on the ground when I was working at KCS. And it's interesting, I was just talking to Commissioner Vasan today, and I'm just so grateful that we have a fellow AAPI in that role, because I think it's so important, to have that understanding and lived experience from understanding the challenges, that we experience on the ground. And so, I think the challenge has always been, how do we have more access, and what does that look like? And, when I was at KCS, I think one of the reasons why we started the mental health clinic there was because there was such a need for services in language and in a culturally competent way. And then we got the clinic and the license and everything running. And then I was like, crap, where am I supposed to find like a bilingual LCSW or, element, like all these social workers? And then, we know this instinctually by doing all this work on the ground, that there's a lack of a pipeline of people in our community that are going into these fields. And that's one of the things that we're experiencing right now, is that there's a huge shortage of workforce in the healthcare sector in general, but especially in mental health. And then when you whittle that down even more to specific languages, it's even more rare. And folks like, Teresa, that have been doing this forever at AAPI, Isabel Ching and Hamilton Medicine. And I know Dr. K from India Home is on here, and there's a lot of folks and experts on the ground, but I think we have to really think outside the box. Can we create incentives, scholarship opportunities to encourage more people to get into these fields? How do we talk about it at an earlier age in grade schools as well as colleges to encourage our communities to go into these sectors? And, we're facing a huge challenge. And I think, on the city side, when it comes to the budget, how are we going to support a lot of our CBOs that are in this room that are going to be providing the services on the ground? And I just want to emphasize, it doesn't have to be clinical. We all know that there's a lot of evidence-based practice on non-clinical, mental health support, whether it's through CHWs or peer-to-peer. So I think we need to figure out also on that side of the city council, how we're going to fund a lot of these groups, because they're very underpaid. You come out of social work school with a master's degree and you get a job doing clinical work for like $50,000, and that's not incentivizing people to get into the sector. And I think oftentimes we are losing people to larger institutions, maybe in hospitals, right, where our workforces are sort of being shifted around. And it's great that overall we're helping the community, but how do we also build that network to our CBOs? Because our communities come to us, right? They don't necessarily, they're not going to go, if they're experiencing, for example, hate crimes, they're not necessarily going to feel comfortable going directly to NYPD, but they're going to come to the faith-based leaders, the gurdwaras, the mosques, temples, churches, and they're going to come to the CBOs, like all the ones that are here. And so how do we make sure that we are creating that access, that we're funding people the way that they need to be funded, and that we're providing in-language services, in the communities that are needed. So those are some of the things that we're working on. I know that there's a couple bills out there that we're working on related to some of this stuff, but that's just a snapshot of what we're trying to do.
Thank you so much. That was wonderful. Thank you. Dr. Ahmed, would you like to tell us a little bit about your work, please?
Great. Thank you. It's an honor to be here, especially on such a panel with other esteemed colleagues. So our work at NYU at the moment is focused on measuring discrimination, specifically Islamophobia or anti-Muslim discrimination and the health implications of that. So we look at mental health outcomes and also medical outcomes as well. And our focus on this topic is really centered on the fact that Muslim Americans in this country have faced discrimination in various forms, attacks on mosques, hate crimes, government surveillance, and profiling. And there hasn't been much research or support for Muslim American communities in looking at how it's impacted their health and well-being and safety in this country. And given that diversity of Muslim Americans, we're also looking at intersectional discrimination, whether it be xenophobia, homophobia, racism, et cetera. And then in terms of the focus on AAPI populations, South Asian Americans are the second largest group of ethnic group of Muslims in this country. So our focus is on that. So in addition to, understanding and researching the health implications of Islamophobia, we're also working to design interventions to provide support to these various communities who have dealt with discrimination for years. And so our work is really centered on partnering with community-based organizations and faith-based organizations, given their knowledge, local knowledge, understanding of networks, et cetera, and having the trust of community members. And so through those avenues, we have community health workers who are involved in peer educator initiatives, and then also just working within our healthcare system to make sure that resources are being directed towards communities that don't have access to it for whatever reason, and then also direct community outreach to educate community members about available resources, answer their questions, and also ensure that the services that are provided are culturally tailored, relevant, and also available in languages that are accessible to them.
Thank you very much. I know you've written many scholarly articles on health inequities. So the research is so important in this direction. Really appreciate it.
Thank you.
Sunanda, would you like to tell us about your work, please?
Yes, thank you for having me. And I'm loving hearing about all the work that's happening in the community. So that seems like an added benefit of being here. I'm a practitioner, so I'm working mostly with individuals and groups right now. So most of my clients are Asian or Asian, South Asian. There's a big mix of clients I'm serving. And I run a couple of groups. Most of my clients, as mentioned before, are queer or trans. And I run a couple of groups also focused on queer and trans identities. And one of the things which comes up a lot is about finding ways to be authentic in a world which is really, really trying to make folks adhere to what seems to have been told to them to be normal, which I'm realizing more and more is how to be more white, how to be more white American, and how to, and that often ends up being suppressing their own cultural values, their own beliefs, their own comfort. So a lot of the work is around helping them figure out what spaces they can be authentic in. What does that even look like? And how to be able to stand authentically in a world which makes it incredibly hard and often unsafe. And in the last couple of years, that of course has gotten a lot worse, a lot harder with all the anti-Asian hate, all the violence, and all the isolation. Some of the work I hope to be doing in the near future is also like working with organizations to help them understand what mental health support their employees or stakeholders need, providing more group services focused on folks learning how to communicate in ways which work for them and not just how it works for the white folks they are interacting with. So that's a little bit of the work I've been doing, and I am excited to know more from everyone else.
Thank you. Really appreciate that your description. And I think that's a natural segue into the work that Aperture Community Health Center is doing. We serve LGBTQ individuals, and we have a trauma-informed perspective that is what trauma has the individual suffered. And when we think about immigrants, we have to think about the trauma of nations as well as individuals. And this approach takes into account not the perspective of what is wrong with the person, but what has happened to this person, what is their story. And we try to have this perspective inform our work in terms of policy, procedures, and new initiatives. We're very excited to announce that we are opening a clinic in Jackson Heights on 37th Street. And we hope very much to be coordinating with all of you. And now I think we could turn our thoughts to what are some of the challenges that are being faced by your organizations and communities. Ms. Lee, would you like to start?
Sure. Gosh, where do we begin? I think a lot of folks here know what a lot of the challenges are that are doing the work on the ground. So I mean, some of it I alluded to before, which is, we're having a major workforce shortage. We don't have enough people that are speaking the languages. And, I'm just trying to think outside the box, because obviously when it comes to the compliance and regulatory and licensing piece, a lot of that does lie with the state. And there's only a certain type of, there are only certain types of mental health professionals that can diagnose, for example, right? So you have psychiatrists, psych NPs, LCSWs, and I think in certain instances, psychologists can also diagnose. And so those are very few and far between in terms of the types of professionals that are out there. And when you, again, look at language diversity and culture in those circles, it's also even smaller of a percentage. And so I think, something I really genuinely been thinking about is, how do we, for example, for me, I'm as a social worker, right? Like, how do we honor the licensing piece? Because I know social workers fought so hard for many years to be recognized, right? In terms of being a recognized field that is licensed. So how do we honor that, but yet sort of think outside the box in terms of what services can be reimbursed by other mental health professionals that maybe do not require as much training or education? And how do we look at that in a very creative way? And that's something that I spoke to the OMH commissioner about, Ann Sullivan, because, given that we have such a workforce shortage and a mental health crisis, I think we have to, think maybe about what are some services, like, for example, that insurance companies, which I know is challenging. I know Luna Lou's on here from Metro Plus Health, but how do we think through what certain insurance companies are willing to reimburse that maybe are not traditionally reimbursed, that clinics and FQHCs and other community groups can get paid for? How do we really effectively use our peer-to-peers, right, and CHWs on the ground more effectively through some of the community-based organizations to really do a lot of that important work that is evidence-based that could get paid for, right? So I think the challenging piece to this is that How do we get people through the pipeline quickly and effectively without sort of diminishing the importance of a lot of these professions, right? And where can we parcel out certain pieces of that to the community groups and actually give them funding to do that work? So I'm just trying to, I've really been trying to think through this challenge because it really is a very nuanced and complicated piece when it comes to the licensing and the compliance. And I think we need to think through, okay, what are some things that we can streamline, for example, so that it's not so hard for people to get an Article 31 license to provide services in the community. And I understand and I get that there's a lot of regulations, there's tax dollars that we're talking about here, but at the same time, I don't know that it has to be super complicated. And those are sort of conversations that I'm having with folks on the government side of things. And I do think that there are ways to legislate it, but we all know that we can't legislate our way completely out of this. I think it's only one piece of it. So we need community, we need legislation and policies that make sense, and we need to get more of a workforce out there. So just some quick thoughts I've been thinking about these days.
Certainly is a challenge. I've heard the workforce shortage referred to as the Great Resignation, but I don't quite agree with that, because that word resignation, I think, implies kind of giving up. And from what I've heard so far from the panelists, this panel is really very energetic and is nowhere near giving up. So I'm really encouraged here. Dr. Ahmed, would you like to talk about some of the challenges that you are facing in your work?
Sure. So from a research perspective, access to data is one of the biggest challenges. AAPI is a broad category with, I think, 50 plus ethnic groups. And unfortunately, everyone gets categorized as Asian, which doesn't give us that granular data that we need to look at health disparities among specific ethnic groups. Additionally, we know that Asian Americans have struggled with the model minority myth. And so a lot of times, some officials may not recognize that there are issues going on, health issues going on in Asian American populations, Pacific Islander populations. So getting access to disaggregated data would help us reveal those health disparities that are currently ongoing in our communities and make sure that we can direct resources to those communities and groups who are facing these health disparities. The second issue that others have touched upon during tonight's session is access to mental health services. So folks have talked about a shortage of mental health workers and the lack of diversity. I think there's some statistics showing that about 80 to 90% of therapists are white in this country. Correct me if that's wrong, but so that brings up the issue of finding a therapist who speaks your language or understands your cultural background, right? So if you're not able to communicate with your therapist, and or if you are able to speak English, you might find yourself educating your therapist about your cultural background, your religious background, et cetera. So having that diversity within the mental health care profession is really integral. And that speaks to initiatives to encourage people to get into the profession, stay in the profession, and then, help with, the loans, employment, placement, et cetera, that goes along with that. So those are some of the two big issues that we're facing in our work.
Yes, I think you've hit upon a couple of very important things. It really is a challenge getting cultural and linguistically competent professionals to work with these populations. And we, at AAPI, our FQHC, we try to meet people where they are and give them access to healthcare, which means things like engaging our support services staff and providing people with insurance enrollment and doing things like authorizations for certain procedures and medications. And I think that the role of research is so important to document all of these efforts and to show people what is really going on, because research is what drives policy and drives funding and lets people know who we are in the Asian American Pacific Islander community. So thank you so much for that. Sananda, would you like to share with us challenges that you're facing as a private practitioner?
Yes, and I will just say this, I already have a long list, so please cut me off if I'm talking for too long, because there are a lot of challenges. From the client's perspective, the biggest is accessibility. As a private practice, I'm lucky enough to be working in one which tries to do whatever we can to make mental health more accessible, but it's still hard. Insurance becomes a big issue. And before I started working as a practitioner, I was like, why aren't more clinicians taking insurance? And within 6 months of having to call insurance and spend 3 hours on the phone to not get an answer, and it took like not getting paid for almost 9 months because of insurance issues, the answer was pretty evident. So accessibility is huge. Even the folks who have insurance aren't able to use it because clinicians are getting burnout by trying to have to deal with insurance and getting a very, very measly amount refunded. So insurance is not paying us what we are worth and the time we are spending. So we aren't able to accept it, which makes mental health less accessible for clients. So that, I think, is one of the biggest things. The other is in our education systems. I guess most, if not all, practitioners have gone to grad school of some kind or another, spent a lot of money in getting that education, getting that degree. And those degrees have professors who are mostly white, and even the professors who aren't are talking a lot about research which is done by white people for white people and is not really helping us understand the language around mental health for our populations. One of the things which I know working with especially Indian folks is using words like depression and anxiety are a big no-no. It shuts that conversation down instantly. So in my opinion, we need a whole new language around mental health, which is more accessible and more relatable to folks in our community. I would love to have some of the research Dr. Ahmed has been doing as part of my grad school degree, rather than spending more time and energy after I've already graduated looking things up, trying to get competency, which I'm not getting in the school I pay so much money to. So those, I think, are some of the major challenges which are coming up. And then there's, of course, stigma. Clients not reaching out to mental health professionals, even when they do have access, because they don't know what therapy means. I still know that some folks think it means electroshock therapy. Maybe that's more in India, but I don't know. So those conversations aren't happening enough. And when they are, they're happening in languages, in words which aren't relatable to our population.
So true, thank you. I think you kind of hit the nail on the head. Mental health is not accessible to many people for various reasons, including the fact that mental health is stigmatized. And we really need to talk to people about what is going on for you and your family, and how are we going to help you. What is your view of what the problem is, rather than trying to fit people into boxes to say, well, you know, you have this diagnosis or this diagnosis, rather to look at people in a holistic way, which is one of the things that I really like about our organization, because we are primary care, and the primary care providers are very integrated with mental health services, and we all work together to try to address the needs of the person as a whole. So I think in terms of what is going on in New York and the rest of the country as well as the world, we have suffered individually and collectively so much trauma. And trauma really requires ways to find ways to heal people. So I am wondering if any of you would like to talk about ways that you feel healing might take place. What can we offer our communities and the people we serve in terms of healing? And I see that we're getting very close to our time here, and we're going to be taking some questions from the audience. But would any of you like to talk a little bit about any ideas as far as moving forward in terms of healing individuals and communities?
I think with healing, some of what folks have already talked about, of not just clinical, not just therapy, but finding ways of connecting community to each other, peer to peer, or to family, to folks' support system. I think the pandemic has also really isolated folks. So helping bridge those connection gaps is a huge part of healing. Helping folks realize that the struggles they are facing aren't just individual, but systemic, and not just systemic, but generationally systemic. I think it also helps folks feel a sense of relief, because that burden which they think they need to be carrying all on their own, they realize that, okay, it has been put upon me. I didn't just choose to carry it. And there is a huge amount of relief in realizing that it's a struggle which comes from somewhere. So I think a lot of therapy talks about the individual and what can individuals do. I like externalizing all the problems. Let's talk about how your depression is coming because of living in a white supremacy world. Let's talk about how your anxiety is coming from a systemic issue of not having the world be affordable to live in. And then talk about how do we live through it, rather than say like, okay, here, you have this diagnosis of anxiety that is a chemical reaction or a personal failure. So those are some of my abstract thoughts, but I think just opening up that conversation and helping folks connect and not just be taking on the burden alone can really help with healing.
Thank you. I feel like we could go on and on with this discussion. It's so rich, but I'm going to take a minute to just ask Nita whether we should continue here, or because I know that we have some time constraints.
No, I encourage you all to continue conversation, because we really want to focus on collective healing and understanding how you all see that.
Okay, thank you. Ms. Lee, would you like to share your thoughts on the healing process?
Yeah, I'm sitting here and I was thinking about how to respond to that question. And I think it's a very difficult one to answer, because I think, a lot of times in order to heal, you need to first recognize that there's trauma or an issue that has happened. And so I think, it's hard to get people to that place also where they can, admit that there's something wrong, and then how do you go from there? And I think, I think what we can do to make things easier, I would say, is, make sure that it's, my mind goes back to access, because I really feel like having that access and bringing people into the mix, it does help. And I keep thinking back to my time when I was at KCS, and it was it was almost like the surprisingly very simple things that we would do as an organization that I think brought a lot of healing. For example, we had, actually it was through, I think it might've been through NYU, the CSA program, but we had, you know, a caregiver program that we did. And I was amazed at how effective that was and how impactful that was, because, you know, you have a spouse who you've been living with for like 30 years and you're their caregiver, or you're an adult child with a parent that you need to provide, that you need to watch over. And that level of stress can oftentimes take such a toll without you even realizing it. And, you know, you're not supposed to be worried about that because you're supposed to be taking care of someone else who's sick or dying or something. And so it's almost like this feeling of guilt at the same time, because, you know, you feel like you can't complain or you can't, you know, say anything because of the other person that you're taking care of. And it's interesting because when I observed this group, the caregiver group, it was so amazing because it's not even like they were talking about the issues itself, right? But just being in that space and kind of, I guess, like what you're saying, Sunanda, right? Like just being in that space where you're sharing with each other and you're with other people that are going through similar experiences. I've seen how impactful that is. And especially on top of that, when you're with people who are experiencing the same thing and also from the same cultural background, and there's like a unspoken understanding that everybody has in that circle. I think that actually does a lot more than we give credit for sometimes or recognize. And it doesn't have to be so complicated sometimes, I feel like. I think there is very simple touches that we can have that can help people's souls, I guess you could say, and help with that sort of feeling of burden.
You're so right. I think that we're so social and we need to touch one another. And the pandemic has kind of created this, you know, ongoing way of being that we're isolated. And we've heard so many sad stories about people in the pandemic and even around the world as people suffer through wars and all kinds of other traumatic events. So Dr. Ahmed, are there things in terms of research that you think could contribute to the healing process?
I agree with what the other panelists have said in terms of healing. From a research perspective, I mean, we know that there are different treatment models that can help people at the individual and community level. So therapy, getting involved with advocacy groups, et cetera. And then I also just want to emphasize that healing can, or, you know, coping mechanisms can take different forms. It could be therapy, it could be, you know, getting involved in some sort of art or music hobby, it could be gardening, just to acknowledge that people heal in different ways and, you know, find relief and peace in different activities. And also to acknowledge that for some people, you know, having that community, as others have noted, is really important, right? Someone who has a similar background, similar experience as you, just to have someone who understands what you're going through and validates it and doesn't question it, right? So that's really important, but not everyone has that community, right? For various reasons, whether it's because of geographic location or, you know, estrangement from family or community members for various reasons. So I do want to acknowledge that. And I think with the pandemic, as others have noted, that's really isolated a lot of people. And I mean, I will say, I mean, although I think a lot of us are struggling with Zoom fatigue, virtual spaces have been a way for people to connect with others if they are feeling isolated. So there are different ways to connect with people. And then additionally, some people find that getting involved in advocacy efforts is really therapeutic as a way to sort of respond to what, if they're dealing with hate crimes, discrimination, whatever, like getting involved in efforts to, lobby their elected leaders or, get certain bills proposed, that has been very beneficial to them. But I do want to acknowledge that's not for everyone. It depends on what you're comfortable with and, what you're able to do depending on where you are.
So true. And I think what all the panelists have pointed to is the importance of self-care. Before we can care for others, we do need to take care of ourselves. As they say, when you're on the airplane and they're doing that oxygen demo, you have to put the mask on yourself before you put it on the person next to you. So thank you so much for those comments.
Hi, yes, thank you all. If you don't mind, I know we're getting close to time, but I wanted to just at least address one audience question. Everyone okay with that? Okay, and it's actually two folks are asking very similar questions, but it's around thinking about visas for social workers, for therapists. It's a big barrier for bilingual clinicians and contributes to a shortage. So, we received the question from Dr. Vasundhara Kalasapudi, the Executive Director of India Home, asking about, what can we do about H-1B visas for social workers? But we also received a question from Therese Rodriguez, the CEO of AAPI Community Health Center, about, there are professionals unable to practice because of visa issues. Is there a way we can loosen them up? I know that might be, it's really for all of you just to think about that question, but, feel free to answer.
Is our Congresswoman still on? Because I feel like that's no, I mean, so one thing I can speak to, at least from the CBO side of things, is that one of the things that we did a lot was actually sponsor H-1B visas through KCS. And I've noticed a lot more, students that are bilingual or from other countries that are coming here from other countries. And I think it's a very great way to build that pipeline, to be honest, because they have a heart, they want to serve the community, they have the language expertise. And so we've actually had quite a number of staff through KCS that we've sponsored, and then who have eventually gotten their green cards through KCS, which I'm very proud to say, because I think it's important to and eventually, even if they leave us, I think it's great because at least, we were part of that story and we're sort of helping them to get whatever professional development that they need and then send them off to do their thing. And, hopefully it's with us, but if, I say us still, because I feel like I'm still the organization, but, to still like to have that. And I think that's one way to build the pipeline, to be honest, but, I know that it's gotten a lot more challenging also getting the H-1B visas approved. And so I think that's something that we need to work on from an advocacy standpoint as well.
Yeah, it's a funny question because earlier this year, I had to stop working at an organization, at a nonprofit, because of my OPT visa restrictions. That's why now I'm working full-time at a private practice where, of course, accessibility issues are more prominent. So I think in terms of sponsoring H-1B visas, it needs to be less complicated. It needs to be cheaper. I think this is just a point on healing and challenges and visas all put in together. I kind of don't know if healing is possible without systemic change. I don't think it is. I think the biggest challenge which clients are facing, we as community members and clinicians are facing, is white supremacy and capitalism and all the homophobia, transphobia, and all of the divisive things which keep us apart. And I think with H-1B visas or other visas, that also comes in. It's complicated because of because of believing that immigrants need to jump through 5,000 hoops to actually be worth being Americans or being in America. And I think all of it comes together. We need systemic change. We need insurance companies to change. We need to value mental health So I think if we start changing one aspect of it, it would actually have the trickle down effect, the one which actually works, of reducing stigma, of making mental health more accessible, and increasing Asian folks who can come in, who want to come into the country, speaking all sorts of languages, wanting to actually reach out to their community members, and then community members would feel safer in these spaces.
Okay, just to keep end of time, I think we should be wrapping up, but I'm so appreciative of all of you here. This has been such a wonderful conversation. So thank you so much, June Matsuyoshi, for just moderating this, and to all of our panelists, Sunanda Jalote, Dr. Nahid Ahmed, and Councilmember Linda Lee. This is, just really deeply grateful. I also would like to thank Congresswoman Grace Meng for her keynote speech. Also Commissioner Vasan for joining us as well and giving a speech. And in addition, I just want to thank our planning committee. This would not have been able to be done without them. Yuna Yoon, Yinshu Liu, Reina Wang, Zishan Gao, Sabine Shalwani, Francis Wang, Amy Lin, Alicia Long, Matthew Chin, Susan Liu from Representative Meng's office, and Casey Latchkey from Councilmember Linda Lee's office. And finally, I want to thank you all for joining us today. Please make sure to fill out our Google form to provide any feedback and to stay in touch with us for all future events and actions we want to do around API mental health. You can find us here in the chat box. And I hope you all have a wonderful rest of your night. And
Sorry, can I just say one last thing before we end?
Absolutely.
So one thing that I would really encourage you all is that, and this is just me being new to the whole process on the city council side as well, but I think oftentimes the best pieces of legislation come from the community, and I think that's where a lot of my ideas have gone in. And so if you think that there are certain bills or pieces of legislation that would be helpful on a local level, or even something that we could try to push on the state level when it comes to legislation or, licensing or anything of that sort, definitely reach out to us, reach out to your local electeds, because what they can do is then that turn those ideas, speak to the city council attorneys, as well as like on the state level, they have people that draft these bills and can tell us how feasible it is or not, and to see what can be done. And I think, that's one of the reasons why I wanted to run, is because for so long we've been trying to advocate on the community side. And so now how do we change that into effective legislation that can complement the work that you guys are doing already? So I think even here, there's a bunch of ideas that have been brought up. And so how can we turn that into something that could either be backed by funding or initiative pieces or, legislation? And I would just like to just put that plug out there, because, thinking about healing, I think you hit the nail on the head, Sunanda, is that I think part of the healing also, and also Nahid said it too, I think, where it's really about accessibility and making sure that we make it easy for people. So for example, I know folks that are really struggling with substance use and mental health, which are super, high rates of comorbidity. And the last thing you want to do is have someone go into one door to receive this service and then another door into another service. And the insurance companies are making it difficult sometimes, and the doctors are not communicating with each other. And those things really discourage people from seeking help. And so how do we make the systems better, right? And I think that's one of the things we need to figure out on the community side too. So I just wanted to end with that thought.
No, I really appreciate it. And I think would also love to plug Project Charge here for that work, because we really do want to do action steps around this, both on advocacy and policy. So, folks here, if you're interested, we do meet once a month on Thursdays, and I can provide those details if you reach out to me. But, we really want to be able to make sure that with this event, it's not just us having just conversation, but we also have action steps. So, I really appreciate you mentioning that, because that's so deeply part of this work as well. Thank you all. And yeah, let me just put my email in the chat for those who might need it.